On the story of the day, for vulnerable homeless Edmontonians, since I last briefed you, I've reached out personally and directly to the Premier, as well as spoken to a number of ministers, the Minister of Seniors and Housing, the Minister of Community and Social Services through my staff, and the Minister of Municipal Affairs directly. And while we appreciate the provincial government's continued effort to engage us on this public health crisis, delays in decision-making at the province are hindering Edmonton's ability to act swiftly and proactively to protect people experiencing homelessness and in turn protect the broader population from COVID-19. Now, under regular circumstances, our homeless population is exposed to a variety of health risks, and that is why for years I have pushed for housing as part of the solution. One of the elders who we've listened to in the past said that for members of the Indigenous community, housing is the best medicine. And never has this been more true than now. COVID-19 has exacerbated the health risks facing our homeless population: lack of stable shelter, irregular food supply, and lack of access to proper hygiene facilities, which makes them particularly vulnerable to infection. Self-isolation is almost impossible for those living on the streets, and shelters have had to reduce their capacity due to social distancing directives from Alberta's Chief Medical Officer, which of course we support completely. The virus is not beholden to any constraints. If our homeless population is not protected, the virus may spread to other communities in Edmonton and therefore represents a clear and present risk to overwhelming our emergency responders and the healthcare system. To be absolutely clear, the city and our agency partners stand ready to activate an appropriate city facility as a shelter. Police support this approach. Most of our homeless serving agencies support this approach. This option has been before the government of Alberta for several days. I want the city to take action on this, but without Alberta Health Services embedded in the activation to manage intake and public health risks, the risks of concentrating so many people in one place would be too substantial for the city to take on our own. If the province wants to take a different and more distributed approach, which seems to be what they're doing in Calgary, the city, of course, will do everything that we can to support that. But I need the province to make a decision now.